Well, election day stress and stress from the pandemic is taking a toll on our health, including our dental health. Yes, you heard that right. Lots of us are clenching those jaws. Joining me to talk about that is local dentist Dr. Sonya Reddy. Good morning. Appreciate you joining us. What problems are you seeing in your practice these days?
Thank you for having me. I'm excited. What I'm seeing, we're calling it the COVID clench. What we're seeing is a lot of broken teeth, a lot of clicking in the joints, a lot of headaches, a lot of muscle aches. We're thinking it's all caused by the stress of the pandemic.
Now, jaw clenching can cause simple problems like headaches. Tell us about what larger problems can it cause?
I think jaw clenching can lead to muscle aches and migraines, and also sleep apnea can be caused by all these pandemic issues. The stress is, I think, a main problem for it, and a lot of people are not diagnosed with sleep apnea, so they're kind of interrelated.
Now, before I move on to my next question, because I kind of had them all written out here, but I want to ask you this. For folks who really don't know, Dr. Reddy, what exactly is jaw clenching? What does that mean? What does it sound like? What does it look like for folks?
Jaw clenching is, I think, when people actually clench their teeth and you actually can hear that they're either grinding or clenching with the muscles being activated. And usually you can recognize that in the dental chair, but because you can see them broken teeth, you can see cracks on their teeth, or you can see they have wear facets on the teeth or gum recession and sensitivity on the teeth.
Well, what can folks do at home? Is there any way to recognize it at home, or are you saying, look, y'all need to keep up with your dental appointments? But what are some ways, or are there any ways that we can recognize this at home?
Absolutely. I think you can see it by the signs on the teeth, and also you can recognize it because if you wake up with a headache and neck pains, or you can sleeping partner can attribute that and say, hey, I hear you grinding at night or clenching, or snoring could also be another problem caused by grinding of the teeth. So I think for a person, for anybody that's going through the stress, I would recommend highly to not miss their dental appointments, go to their dental appointments. That way their doctor and dentist can see they've shortened the teeth, they actually have wear facets on the teeth. So I would recommend going to the dental office and making sure you don't have grinding and clenching. And of course, we fabricate oral appliances for them that are custom made to prevent it.
Okay, good feedback there. Of course, I knew certainly that folks needed to make sure that they were keeping up with those dental appointments. Look, one solution for stress, of course, with everything that we've been dealing with here this year, 2020 has just been a stressful year in general, antidepressant medicine. But, we've learned that can also cause jaw clenching. Why is that the case?
Yes, antidepressants are definitely, I'm glad you asked that question. Antidepressants are definitely causing jaw clenching as a side effect of that, because I think it's neurological. It actually triggers part of the brain, amygdala, which causes the jaw clenching. But I think mainly there's other physiological reasons like GERD and all the medical issues are also causing the jaw clenching and bruxism. I think the bigger thing that I really want to stress here is it's not just the jaw clenching and the teeth grinding. It actually causes damage to your teeth and fillings and crowns. So when you actually break the teeth, you have bigger problems like root canals, and you have to extract the teeth and do implants. And even implants, when you restore them, because of the jaw clenching and grinding, you actually see that they're failing as well. Think of like a porcelain plate. When you hit against a hard surface, eventually it cracks.
That's some good advice there, and I'm happy that you mentioned that, because no one wants to sit in that chair going to get another root canal because we've messed up what we have in our mouths already. Dr. Reddy, thank you so much. Truly appreciate you joining us this morning.
Thank you for having me.
Absolutely.